Hi, Dr. Mantecon. How are you today?
Hey, how are you, Javier? How are you? So
I'm
good to
good.
see
I'm
you.
good. Good
So
to see
good
you
to see
too. I'm
you.
happy and I have a lot of questions today.
Okay, tell
I
me.
would like to talk about something uh, very interesting because we have a lot of misconception about it. What's a vagina and what's the vulva? Can you explain us?
Okay. Yes. Of course. In For some reason, I don't know what started what. A lot of people use only the word vagina in reference to the external genitalia of the female. So, just by saying that, you can understand all the misconceptions around it,
Right.
because the external genitalia, that's just the name of all of the structures in the external genitalia, all the region that is between the legs of the female body. Okay.
Right. Because
The
when I was
external.
doing like
Tell me.
research about it, it says that it's the like the canal, the weight of the internal that gives birth, right? So that's the vagina itself.
That is just the vagina. But what I am trying to say is that whenever people describes or talks about the vagina, in reality, they are talking about the external genitalia of the female body,
Right. What we see.
uh, and not the vagina.
Okay.
They call it. It's like saying, um, uh, "I like your nose" when they are referring uh,
External.
to the face, or
Uh-huh.
I like your throat when they are referring to the face. That's the misconception, the first one that we need to understand. So the vagina is one of the structures that form the internal genitalia of the female body, not the external genitalia. The external genitalia has the opening of the vagina, which is an internal organ. But
Okay.
however, people use the word vagina when they are talking in regard of the external genitalia. External
Can you
genitalia are the organs that are between the legs of the female body. Okay?
can you show us you have a little thing that you can show the
Oh
patients,
yeah.
right?
Yes. I'm going. But is that clear for you? I mean, do you understand
Yeah,
that you are?
I see now the difference. So what they call the vulva is the external part of it with the lips and everything, right?
Yes, correct. So
Okay.
this is an example, puppet that oh, válgame Dios.
Mhm.
Okay, this is a puppet that represents the external genitalia, which is called the vulva of the female body, and
What are the parts?
you can see different structures of different parts. You will
Uh-huh.
have the labia majora, which are those around these little things. They in this case they are exaggerated, to make to show the difference between each of the structures of the organs. But in reality, they these can be really small, really petite, or can be very exuberant, like in this case. But
Okay.
we have on the sides the external, the labia majora, the labia minora, and then this, which is also exaggerated to make the point of its existence, is 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 the skin that covers the the head of the clitoris, which is this little button there. Okay, so
Okay.
everything here is the vulva. Everything here is the external genitalia. Usually, if you see a vulva, it will be like this. It will be closed like this. Okay, but then if you open the legs or extend the opening, the legs are more extended, is what I'm trying to say, a little bit will open, and you will be able to see something like this. This one is the meatus urinary, where people pee.
Okay.
Urine comes from that little hole. In reality, it's a hole. We have a flower here, but it's a hole. And on top of it, you see the head of the clitoris. The clitoris is an internal organ as well,
So it's
but
not always exposed.
it's never exposed.
It's
It's
never exposed.
always just the head, just the head. And sometimes the skin that covers the head of the clitoris can be like this. A little bit of it will be exposed like that, or sometimes it will be like that, completely covered.
Okay.
Okay, but both are normal and beautiful, obviously.
And
So
there are always different shapes because
yeah,
different people get like bigger how do you call that, the lips?
yeah, it's like the face of our head, you know. Some people have bigger eyes, or closer eyes, or more separated eyes, or a more prominent nose, or the mouth, right? Or the lips are more exuberant or more thin, right? So you will see difference in the face. It will be the same for the structures of the vulva, okay?
Right.
But as I can describe the parts, there is no vagina in here, because the vagina is the internal organ that goes after this entrance, which is called the introitus. The introitus is the opening of the vagina. Is like in the mouth, you have the lips, right, that surrounds the opening of the mouth. In this case, the vagina is an internal organ. You see? What
Right.
you see here is just the opening or the entrance that goes into the vagina, because the vagina is a canal that goes inside the
Right.
body, connects with the uterus.
So in this area, what's the most sensitive part of the vulva?
Uh, Everything is sensitive, but in regard of pleasure, what we know is that the clitoris is the most important, is the most sensitive in regard of pleasure. But don't get confused, because let me show you uh, um, anatomical clitoris.
Oh
This
wow.
is this is an inside organ. What we were seeing on the puppet was just this little section, this little part right there. This
Hmm.
this just the head, just the tip. The rest of the organ is inside the pelvis of the female body. And this opening corresponds to the introitus, meaning that if you see the puppet again, you can touch the clitoris if you do this to the sides of the introitus, or if you touch here, right, to the top, you will be touching this part that is
Right.
also feels pleasurable for the female
Is that
whenever.
what people call the G spot?
Well, yes, if people calls that, there is no G spot. There is no
No way. There's
structure.
no G spot.
No, there is no structure in an anatomical medical book called G spot. We know 100% of normal females, newborn females, are born with this organ, which is the clitoris. And we can prove that, using dissections, and we can, if we operate and we cut, I can show you the clitoris, like I can show you the esophagus or the intestines or the stomach or whatever, all the a kidney or whatever. I can show
Uh-huh.
you the clitoris inside of the pelvis of the female body, but there is no structure, anatomical structure, that I can say, hey Javier, this is the G spot. We don't have that. No exists. it doesn't exist in the anatomical body.
Wow.
It's a misconception.
So it's
Actually,
another misconception about the vulva and the vagina,
yeah,
the G spot. But there are points of this whole organ that will have more sensitive areas and will create more like orgasm if we touch it or we do something with it, right?
yeah. Well, as I said, if you introduce your finger or fingers are in at the to the vagina, to the around the introitus, if you touch this, you can stimulate the organ. It's like touching the body of the penis. All this
Right.
is like, touching or stimulating the part of the penis. And if you touch this section, which is the glands of the penis, the head of the penis, it will be the same for the clitoris. It will be the same in regard of pleasure. In the puppet, for example, if you do this inside the introitus, inside properly now the vagina, because you are introducing the
In there.
finger of the penis to the canal, the vagina, then you can stimulate around it. You
Hmm.
see, in those parts around it. Or if you remove the skin, like removing the prepuce, that is the skin of the penis, if you remove and expose the head, obviously you can touch it and stimulate it, right? To have a pleasurable sensation that may lead to an orgasm,
Right.
right?
Okay.
And it is
So
important, Javier. It's important because a lot of people consider that the orgasm of the female, the orgasm of the woman, relies on the penetration, the vaginal penetration. And that's a misconception because what is needed is a stimulus in the clitoris somehow. Okay, so
okay.
you can. It's like for a man. If someone touches you, Javier, you're a man. If someone touches you, your whole body, but never touches your penis, it will be really difficult and complicated for you to have an orgasm if no one
Which is not
touches you.
impossible, but
It's
I
not
could tell.
impossible. It's not
but
impossible,
but it will be easier just to stimulate the right spot.
but it will be kind of difficult, kind of
Right.
difficult, right? So it will be the same for the woman. If everybody touches everywhere, but never the clitoris never receives stimulus, the woman is going to be difficult for the woman to have an orgasm. It can happen,
Right.
but it won't be that easy as if you
And
actually
what if
stimulate the
what if the
clitoris.
woman is not used to it? What if they're not used to let someone touch that part of it?
Well, first she has to touch herself first to know, what are the
Explore.
sensations, that she's going to notice, to identify. It is important. The problem is that in our society, men are allowed to touch their own body.
Hmm.
When parents contact me, preoccupied because their children are doing something sexually that they consider inappropriate. For example, it's because my child is touching herself. It's usually a girl. They talking about a girl. I
Hmm.
never receive a question from parents saying my child, my boy, is touching himself.
Because that's normal, right?
That's normal. But children, they explore and discover their own body, right? As they grow. So, but we only show concern if the child is a girl. We don't show concern if the child is a boy. So that marks a difference in regard of the development of the sexuality of that person is going to have, right?
And
If
there's
we
nothing bad, right? There's nothing bad about girls exploring themselves.
like, it's nothing wrong about boys exploring themselves, right? Nothing
Right.
wrong. It's easier for parents to understand that boys masturbate, right?
Mm-hmm.
Well, they come to the office when they have a girl, a young woman who is trying to masturbate. Everybody's like, what? No. Why she's doing that?
And how do you
Is
explain that to them?
well, the sex education is in regard of how ideas, how constraint and refrain is applied towards women in because women should have certain um, um,
Conduct.
conduct, yes, or attitude towards sex. I was looking for attitude, because if a woman starts saying that she likes sex, or she's interested in sex, or that she wants to experience sex, usually the families are very concerned, and there is some reason behind that, because if she is not educated, is not sexually educated, the probabilities of her having a pregnancy at a young age increases. Or if she is not sexually educated, the probabilities of her getting an infection increases, right? If she's not sexually educated. But the situation for parents is that they need to understand that it applies. That that applies for both, because you can have a boy who is fathering at 13, 14 years of age. If you don't sexually educate a boy in regard of the capacity of his own semen, uh, to impregnate a woman, well, you will be facing the same problems if you don't sexually educate both uh, boys and girls, right? How
Right.
to, um, um, yeah, how to have a baby. We need to
Uh-huh.
say how to have a baby, how to get a pregnancy, how to, and then we start explaining about how to avoid it. First, we need to give the education of the natural, because thanks to the fact that someone had sex, you exist. Thanks
Mm-hmm.
to the fact that
Right.
someone had sex, I exist. The sex is for reproduction. So we need to explain to them that this is, the function,
Part
the
of
function
life.
of the organs, right? For
Right.
reproduction. And then we need to admit and accept and explain to them that our whole body is also, it has also the purpose of pleasure, of connection, of
Right.
intimacy, of relaying, or a lot of things. It's not only about being a man or a woman and in a relationship like that. It's about being friendly, and a lot of things that you can develop in that regard. That the whole body is to connect with the rest of the world. Is
Yeah.
to know, you know
Actually,
that,
yesterday
that
I was thinking about it and I was like, why do we always get the grown-ups telling us that it's not okay to talk about sex? Because I was trying to remember when I was a kid growing up in elementary school, and I remember the principal of school, she would say that was disrespectful and that was not appropriate for us just to talk about it, not even in a sexual way, just the subject itself was prohibited. And nowadays I was just thinking about it and I was like, there's nothing bad. I mean, obviously my parents had sex because they had me, right?
yeah,
And their parents had sex because they had them. So it's something that we all do, but we're not allowed to talk about it. And I think that's so wrong because if we have the proper education about this matter, we won't be uh If we don't
The,
we don't get
we
that,
don't
we
be
don't get to
the
explore.
first state. We don't be the first state in Texas that has the first the number of unplanned pregnancies, and
Right.
we won't be the first country that has unwanted unplanned pregnancies, first war around the world. We are the number one. United States, when you see the stats, the United States is the number one in the first world among the first world countries that has
Uh-huh.
unplanned pregnancies. We are not educating our population. We are not.
Exactly. And if we don't allow these subjects or these matters to come to our mind or to our conversation, the problems are getting bigger and bigger.
Uh-huh.
And that's why it's so important to teach people about this matter. And of course, now we have the problem with abortion, which is another big trouble in the United States because people don't want that. But if we don't have enough information about how's the proper way to reproduce or to enjoy sex, in case if they don't want to reproduce, it's okay to enjoy sex as well. But if we don't have enough information, then this shouldn't be like a matter that is not allowed to talk about.
Correct. I mean, the behavior will change, and
Right.
that's usually, what they state, that if we talk about sex, then we will be encouraging, young ones to have sex, and that is not true. It's proven in other countries that sex education reduces the number of unplanned pregnancies. The reduces the use of the next day pill, reduces the number of abortions, reduces the number of transmission of infections, sexually transmitted infections. So it is important to understand that we are a sexual species. We use sex as communication. We use sex to have contact with another person. And we also use sex to reproduce our species. But it's not the main intent of this function of our body.
Right.
The main intent is uh, just to enjoy life, to enjoy life. And I know that a lot of people uh, with the perspective from religion argue against what I am saying. But the creation of the body, the creation is the body, is the way it is. I mean, I am not saying this out of nowhere. I mean, I'm saying this because how the body of the male and the female of our species function, and the sensitivity that we have in our skin, the sensitivity that we have in our organs. And whenever we reach this that we call intimacy, the connection with another person, we require our body and the sensations from our body to feel what we call intimacy, because you can have sex and enjoy sex, in different ways. But
Mhm.
all people mention that when the sexual activity becomes intimate, it has a different level of connection and feeling, right? With yourself and with the other person.
Right. And it's also proven that we all like it. Mantecon, I
Yes.
have another question about the first topic that we were talking about, the
Mhm.
vagina and the vulva. Is there something called vaginal reconstruction or vaginal rejuvenation?
Yes. Yes, that's something that has been offered by different physicians, because people were requesting some kind of intervention. Now the standards of the appearance of the vulva are changing, and people is under the influence of this standard of beauty. So they are
Hmm.
requesting physicians to actually go and perform a surgery to make the vulva to look different, or make the vagina less elastic, which is a lot of concern because usually when that type of surgeries are performed, they don't care about the clitoris. And it can be that the women may have orgasmic difficulties after this type of the surgeries, after this type of surgeries. Uh,
What do they do when they perform that? What exactly do they do?
well, in regard of the vagina, they actually go inside and cut the walls of the vagina to reduce the size of the walls, to make it more tight. And usually is in regard of women saying that their husbands are complaining about not some sexual difficulty or dysfunction, and they blame the vagina of their women for that.